coming today, and thank you, Darcy, for that kind introduction, and Clara for inviting me to come and share some of my work with you all and try to bring some network analysis to this community. It's a field that I'm very passionate about and have been working in for a long time, I guess about 25 or so years now, and it's a subject that's near and dear to my heart. And I've done network studies in a lot of different domains, a lot of different applications. When you get this much experience, it's always a little challenge to decide what to present. Lately, I've been working a lot on diffusion network models, so I'll focus on that a little bit, but hopefully we'll have some time for Q&A where we can talk about other applications of social networks or other things that you might be interested in. Could you sign in, please? I learn quickly. All right, so just a quick acknowledgement. A lot of my research is funded by the National Institutes of Health. These are a couple of the grants that I have active right now, and there's a list of them. So the outline of what I want to present today is a basic introduction to diffusion of innovations, which is the theoretical underpinning for a lot of the applications of network analysis. Talk a little bit about social network influences and how we understand the way social networks influence behaviors. Then I'll revisit diffusion a little bit, talk a bit about network interventions, which is, I think, probably one of the most exciting topics that's been developing in this field, and then a little bit about network measurement. So, diffusion of innovations. Basically, this is one of the oldest social science theories we have and has been around for a long time. This is a graph from 1943 when Ryan and Gross were studying the diffusion of hybrid seed corn in 2 communities in Iowa. And Ryan and Gross wanted to know what are the things that are associated with farmers' early or late decision to try hybrid seed corn. And this gave birth to a model, a theory, which explains human behavior that actually works very, very well and has been applied to just about every known behavior, many applications in public health, but also in marketing and rural sociology and so on, and provides a really good framework for understanding individual behavior. Essentially, the model says there are a few people that are early adopters. Over time, that process starts to accelerate and take off, and then plateaus once it saturates into the market. So there are a whole lot of things that are associated with early and late behavior change, right? The cost of the innovation, and that cost is widely conceived of as being not only dollar cost, but also transactional costs and so on. The perceived characteristics of the innovation, is it relatively advantageous to what it's replacing? Is it radical? Is it a very radically new, different way of trying things, or is it continuous, and so on? So there's a whole lot of things that are involved there, but it turns out that one of the most significant influences on behavior change is your networks. Now, I came about discovering this because I studied did my PhD with a guy named Everett Rogers, who's really known as sort of the father of diffusion of innovations. And he had an entire room filled with journal articles of studies of diffusion of innovations across a whole bunch of different disciplines. And when you look at all those studies, it turns out that what your friends do, what your colleagues do, what you think your friends do, what you think your colleagues do, are very strong and persistent influences on just about any behavior you can imagine. And why is that? Well, the networks do a whole lot of things, right? They provide information. They give you detailed knowledge about how something works. They may send you a signal about the way to adopt that behavior, the modeling process. They communicate the perception of what is normative, peer pressure. It's a whole lot of things that get transmitted through these networks that result in behavioral adoption by the focal individual. So then the question becomes, well, what are networks and what do we know about networks? And it turns out, now that we've been studying social networks in a lot of different settings, there are things that we know about them quite concretely that we can measure, okay? And these are 4 of the characteristics that I'll just share briefly with you. One, of course, is that networks are homophilous, right? Like sorts with like. So people tend to select other friends that are their same gender or their same ethnicity, their same socioeconomic status. They also select friends on behavioral characteristics. Smokers become friends with smokers, drinkers with drinkers, people who like sports with other people who like sports, and so on. So homophily is a strong and persistent force that creates structure in social networks. The other characteristic that's predominant in social networks is that they are transitive. That is, that friends of friends become friends. Okay? How do you meet new people? You meet new people through your friends. How do you find a spouse? You find a spouse because it's a friend of somebody that you hang out with, or a brother or a sister of someone you know, right? So this transitivity is something that persists in networks, and we know over time that networks evolve towards having a lot of transitivity in them. We also know that they are centralized or scale-free. It turns out that the number of friends we have is not normally or evenly distributed, right? Some people have a lot of friends. Other people, not so many, right? So when we look and measure networks, if we measured the network in this room, there will be some people that are more prominent than others. We call that a person being central, and a network that has that property is centralized, or what physicists like to call scale-free. And I can go into detail about that. And then the last characteristic that's important is networks are not random. There is a lot of structure in networks, right? And so when we compare real human social interaction networks to random networks, we find them to be quite different. And some of the basis for doing statistical analyses on networks works off the principle that understanding we can't compare real networks to random networks because they are different things. So here's a network. These are 12-year-old students, and I've colored the nodes based on an attribute, blue and red. And who can tell me what that attribute is? Gender. Gender, that's right. Boys like boys, girls like girls. They don't interact with one another. There's not a single boy in this classroom that will admit to being friends with a girl, right? Smart boys. There are a couple girls that admit to being friends with boys. And having a 13-year-old daughter, I'm thrilled to see this, right? There's no danger that anything untoward is going to happen in this network. So we have a lot of homophily. And we have transitivity, right? 13 is friends with 6, who is friends with 34, who's friends with 13. So those little triangles get closed. We don't have open triangles in the network. We have a lot of closed triangles. And you can see that there's some centrality in here, right? There are people like 21 and 17 that are very popular, and other people on the margins of the network that are less popular. Now, they may have connections to people in other networks, but in this particular classroom, they make friends with other people but are less frequently named as friends. And we've all been through growing up as adolescents. We're familiar with this process, right? Now, of course, by the time you get to 10th grade, everything changes, right? Now we've got problems. Boys are friends with girls, and now they're interacting in lots of different networks, and things get all kind of crazy. So those of you who are parents, be well aware of what happens when the transition occurs. And we also know that networks are centralized, right? So now these networks are great. They're easy to measure. These are kids in classrooms and schools. The community is bounded. We can simply go in and say, who are your friends? And we get nice, closed networks. But we can also go into very large communities, right? These are physicians across a whole bunch of different states, and ask them who do they go to for advice and who do they go to discuss medical matters with. This happened to be osteoporosis. And we can map these large community networks too. And we can see that there are different kinds of discussion and advice relations in this network. Sometimes they overlap, sometimes they don't. And we can find some people that are at the center of the network that are very prominent, right? And so these would be very important physicians to identify if you wanted to make some kind of intervention, like getting your drug uptaken in this community more quickly. And we can talk about that more in a second. So, but how do networks and diffusion match together? Well, when I started thinking about this problem, one of the first things I did was what all empiricists do, open up an Excel spreadsheet, right, and start playing around with data. And I created a fictional community of 100 people. I said, I've got 100 people in this little world, and I'm going to infect 5 of them with a disease, or make it so that they adopt a new behavior or engage in behavioral change. And these infected people interact with the non-infected people, or the adopters with the non-adopters, and they persuade them to adopt, or infect them, if you will, at a rate of 1%, and at the end of that first year, I have 4.75 newly infected people or new adopters. Now I have a pool of 9.75 infected who interact with the susceptibles, convince them at a rate of 1%, and I get 8.8 new adopters at this next time period. And it turns out, if you let this process play itself out over 10 years for 100 people at a rate of 1%, you get this beautiful S-shaped diffusion curve, right? You could put a bow on this. It's so pretty. Nice. And you have your incidence curve right here, which is supposed to approximate a normal distribution, we hope. This is great. Diffusion is now explained, right? People interacting with adopters and non-adopters and convincing them to adopt at a rate of 1%. And here's precisely the problem. This is all wrong. Yes, it looks beautiful, but remember what I've taken out of here. I've let people interact randomly. I've ignored network structure. So now when you see behavioral scientists talk about this great diffusion S-shaped curve and how great it is at explaining everything, what you realize is it explains nothing because it ignores the network structure that structures who's interacting with whom and how the spread happens. So how do we understand the way networks influence behavior? Well, it turns out that we don't have to be particularly intelligent about this. We can come up with something very simple called a network exposure model, right? Now, and in network terms, we often talk about the focal individual as ego, right? Who the ego is. I think it's mostly because network analysts have really huge egos. They think they're smart, and so they always put it into their graphs. But a person who has a whole bunch of friends, here in this case 5, 6 different friends, and we can look at whether or not each one of those friends is adopters or not and calculate the exposure for each individual over time, right? And we think that as exposure increases, you're more likely to adopt the innovation, right? A person, an adolescent who's surrounded by smokers is more likely to smoke. A person who's surrounded by friends who all exercise regularly is more likely to exercise regularly. So in order to investigate this exposure model, I was in graduate school at the time when it occurred to me that this network stuff might be important, and I thought, well, I'm going to do a diffusion network dissertation. How? Diffusion takes a long time. Right? It's not something that happens very quickly. In fact, most innovations take forever to diffuse when you think about it. TVs being a prominent example that diffuse pretty quickly, but most things take a long time. So rather than spend 20 years in graduate school, I thought, I'll go ahead and try to find some existing data that I can reanalyze to test these diffusion network models. And it turns out that there's this very famous data set called the Medical Innovation Diffusion Data Set that James Coleman, Elihu Katz, and Herbert Menzel had collected in the 1950s in 4 communities in Illinois. And they measured the networks among the doctors, and they measured when they adopted this new drug tetracycline by investigating the prescription records in the 4 communities. So they knew exactly when they started to adopt. And then there was another study, the Korean family planning study, that had measured when women started adopting contraceptive methods in Korea in the 1960s, and then this other study of Brazilian farmers when they started to plant their corn acreage with hybrid seed corn over an 11-year period. These are the only 3 data sets that exist in which we know when people adopted a behavior, and we know the social networks among those individuals. This was appalling to me when I discovered this in 1990 to realize that we have thousands and thousands of diffusion studies, and hundreds and now thousands of network studies, but we don't have studies that put those 2 pieces of data together. What do? We do behavior change studies, right? What's the time window for most of our behavioral science studies? Claire? 3 months, 6 months, a year at best, right? So we only look at short-term changes. We don't look at long-term changes and how things diffuse through communities and systems over time. And that's a real problem, I would argue. So here are the diffusion curves for these 3 classic studies. I put an S-shaped curve over there just for comparison because I like drawing those things. And you can see the medical innovation data, the Korean family planning data have both pretty steep diffusion curves, and the Brazilian farmers is much slower. And to do the analysis of whether or not exposure is associated with adoption, you have to convert your data to a survival analysis or event history analysis data set, for those of you who know what that means, right? So we convert our information from individuals to person-year data, right? So if a person adopts in year 6, they have 6 observations in the data set. If they adopt in year 3, they have 3 observations. And the outcome variable when they adopted is 0 up until the year that they adopt. It's a way to do the analysis over time. So, and when you do this kind of event history analysis, you get two sets of results. One is, what's the effective time on diffusion? In other words, does the likelihood of adoption change over time, and the effect of different variables. And for these three classic diffusion data sets, what we find is no effective time in medical innovation. In other words, the likelihood that physicians adopt it over time stays constant and non-significant. For Korean family planning, it's non-significant at the beginning, but significant at the end. So over time, there's no greater likelihood that they adopt, except at the very end of the diffusion curve. And for Brazilian farmers, it's actually negative early, and then it becomes significant late. So for medical innovation, no time tendencies. For Korean family planning, no effective time early, but late. And then for the Brazilian farmers, we get a negative tendency early and a tendency late. And now that we've controlled for time, we can now enter our individual characteristics and see how they're associated with behavior, right? And so it turns out there's a couple of individual characteristics for the medical doctors that influences their behavior, right? Those that have a scientific orientation were later to adopt. Those who subscribe to a lot of journals were more likely to adopt. And in fact, a colleague of mine, Christoph Vandenbuel, did a reanalysis and showed that actually in the journals there were lots and lots and lots of advertisements for this drug put in there by the pharmaceutical company Pfizer that had created the drug. And he shows that it's actually exposure to those advertisements that led to adoption. Korean family planning data, if you have a lot of sons, you're more likely to use contraception, right? If you're a woman in Korea, at that time, once you've had sons, you don't need to have any more children, you're good to go, right? And for the Brazilian farmers, we found it to be income. But that's not what I was interested in. What I was interested in was this exposure, right? Are you exposed to other individuals who adopt the product, and then are you more likely to adopt it the next time period? And in my dissertation, I analyzed these two data sets, and you'll notice there are no asterisks next to those odds ratios, which sometimes when you're doing this kind of work makes you very upset, right? I've got no exposure effects. And my advisor is Everett Rogers, who thinks exposure matters a lot. I was afraid that the secondary analysis would not speed me through completion of my dissertation, right? It might delay it. So the lack of contagion effects was actually rather troubling, because this is something that we all, I mean, in all of our social science, we know that being exposed to peers makes you do something, and you're more likely to do it. And so I was kind of scrambling around at this point, wondering what could possibly explain this, right? I need an idea. Anybody have any ideas? So it turns out that people have varying thresholds to adoption. We don't all wait until everybody does something before we're willing to do it, right? If we did, what would happen? Nothing. Nothing would ever happen, because everybody would be waiting for it to become normative to adopt it. There have to be some people who are willing to adopt an innovation before other people in their network do so. They have to be very innovative in their network. They are low threshold adopters, right? There are other people that are high threshold adopters. They wait till everybody does it in their network before they're willing to do it, right? So these people have a lot of resistance. I am a high threshold adopter. I never do anything until everybody else does it. Why? Because I'm smart, right? I'm going to wait to have people who can tell me how to use it, where to buy it, how to fix it when it's broken, all the stuff I need to know when I use the innovation. I'm not going to be early. But there are some people, they like to be the first ones, right? They want to be the first people out there to get it, to use it, figure out how it works. These are the people that queue up outside of Best Buy when a new phone's becoming available, right? They want to get that product before anybody else gets it. And then what do they do when they have it? And this is something that they do that I would never in my wildest dreams do. Take a guess. I'm sorry? Talk about it. Just before talking about it, they do one other thing that's really shocking. They read the manual, right? They actually open up the thing and see how it works so that they can talk about it, right? They can tell their friends, look, this has got this new Bismillah jam jinger. This is going to be great, all right? So you have to have this distribution of thresholds in the population in order for things to take off. And here's a graph of thresholds for the Korean family planning data. you can see this is time, whether or not you're early or late relative to the whole community, and whether you're early or late relative to your network. And so you'll find there are people that are early adopters, but they're actually late in their network. Everybody that they name as friends adopts before they're willing to do so. The other thing that this shows you is you have people out here that we normally classify as being late adopters, which we oftentimes associate with negativity, but in fact the only reason they're late is where they are in the network. They don't find out about the innovation until late, right? And oftentimes these are people on the margins of the network, and they're not in a position of advantage when it comes to information and influence. And so one of the things that this kind of network systems approach does is it turns the blame around from the individual being a lazy non-adopter to somebody who, because of their network position, doesn't get access to the information in a timely manner. So after I finished my dissertation, I wrote a book on network models of diffusion of innovations with all this stuff in it in '95. I still had no network data, but I did want to still look at network influences. And so started conducting a lot of studies looking at adolescents and women in developing countries and sort of understanding what are the network influences on their behaviors. And we used the ad health data. For those of you who are adolescent health researchers, you'll be very familiar with this well-known data set. And we're able to show that smokers are more likely to have smokers in their network, and that popular students, the kids who receive a lot of friendship nominations, are more likely to be smokers in high prevalence schools and less likely to be smokers in low prevalence schools, right? Which, time to get up. Which is, this sort of signifies that these opinion leaders, these popular students, are reflective of what the norms are for the community. And we can take the exposure model and, in a series of probably 15 different publications, we started to analyze a lot of ways that we could expand the exposure influences that we have. So, for example, we've shown that individuals are more likely to be influenced by their strong ties rather than their weak ties, right? If you're really closely connected to somebody, they have a bigger influence on you than if you're weakly connected to them. Now, how many people here are married? Yeah, right? You have a very strong tie with your spouse. Who tells you what to do? Your spouse, right? So strong influences make a difference. We also know that people are more likely to be influenced by alters that are connected to one another. So these are the so-called Somalian ties. When people have joint connections to a third party, the influences of those two people have a stronger influence on you than if those two are not connected to one another. The exposure influence reinforces. We've shown that it might matter whether or not the attributes of the alters make a difference or not, right? And so there's some evidence to suggest that we're more strongly influenced by homophilous ties rather than heterophilous ones, people of the same gender and so on. People have looked at indirect influences, right? And many of us find indirect influences out 2 steps in the network. So I can be influenced by the friend of a friend. And some people have argued that you can be influenced by the friend of a friend of a friend. I don't think the influence goes out that far. I don't think it goes out 3 steps. I think it at most goes out 2 steps, and at 2 steps it's rather weak. And we're also starting to show that these kinds of influences can also be transmitted via social media or online social networks. Now, it turns out the magnitude of influence of these online connections is much lower than face-to-face ones. But there are so many of them that the cumulative effect can be quite dramatic, actually. But the effect, nonetheless, is very, very weak. Okay. All right. And the other thing that we've done is understand the way people are connected by joint participation in events or activities. So, for example, for adolescents, if they're on sports teams together, they're more likely to be influence one another than if they're not on sports teams together, or if they belong to certain clubs, and so on. So we can look at individuals and then calculate how much they have overlap in all these other activities and find that that has a stronger influence on their behavior than not. And then finally, the last kind of network effect that I'll mention briefly is selection. Right? And so it turns out that people are not only influenced by the people in their network, but they also make conscious decisions to change their networks to be compatible with their behavior. So for example, if I'm an adolescent and I become a smoker, I'm now going to choose smoking friends over the next time interval, right? Or if I decide to start exercising because my doctors convinced me that I need to do that, I'm going to start reaching out and creating new networks that I can also exercise with. So this selection effect is another mechanism that creates homophily in networks. All right, so looking at all those influences was very interesting, but you know, my passion and love was still diffusion of innovations, right? And I swore when I finished my PhD, the first thing I was going to do is go out and replicate the Coleman, Katz, and Menzel study, right? It was great. We're going to get data on adoption, look at physicians over time, classic application of the network model. And I'm proud to say that it only took 20 years for me to have the opportunity to do this. So it's better than 30 years, but you really, I mean, really? 20 years? That's what it took. So, and I was working with colleagues at the Wharton School of Business, and we were working with a pharmaceutical company, and they, because we were working with them, were willing to give us access to their prescribing records 3 years post-launch of a new product. And just like in the Coleman, Katz, and Menzel study, we were going to go out and interview physicians about their ties, right, at the beginning of the process, and then try to see whether or not these networks are having an influence on physicians' decision to adopt this new drug that was coming out. So here's the network for one of these communities. Now, the surprising thing about this is when we conducted this study was we got a list of physicians that the pharmaceutical company thought were relevant for the San Francisco Bay Area. And I basically just sent them a survey and said, name the 7 physicians that you would go to for advice about this product, and that you, not this product, but this condition, and who you discuss this condition with. I had no idea what was going to happen. I didn't know if anybody was going to send surveys back, and I had no idea who they were going to name. And what surprised the heck out of me was that when I got the surveys back, it was almost as if I had mailed them the list that I had been giving, because they were naming physicians off of this list of 150 or so that I started with, which surprised the heck out of me. And it told me 2 things. 1, pharmaceutical companies are really, really smart. 2, that our networks are really local, right? This was the ones in the Bay Area, and they were naming other physicians in the Bay Area. The other thing that we saw from the data almost immediately was homophily, right? All the European American surnamed physicians were naming other European surnames, and the Asian surnamed other surnames. So there's homophily in the network, right? What else do we look for? Centrality. Yes, there are people that receive a lot of nominations. 1 here, these 3 here. The other thing that was readily apparent to the pharmaceutical company is that they were spending all of their time talking to these 4 individuals that are fairly co-located. From a network perspective, these individuals are virtually what we call structurally equivalent. They occupy the same position in the network. They're connected to the same other people. Working with them to change their behavior is a waste of time. If you're working with one, you're working with all of them. They didn't know, they knew this person existed, but didn't spend any time with him. And it turns out he is critically important to the whole diffusion process to half of this community. So they changed their marketing techniques. They weren't going to go to all these people, focus on one, pay more attention to 175. Went to 175, said, 175, what can we do for you? 175 ran a clinic for low-income individuals. Pharmaceutical company gave him a bunch of supplies for that clinic. And so then what you see is rather rapid diffusion of this new product out from those leaders. And then the Wharton guys do a whole bunch of fancy statistical analysis, which you really have to be impressed with, because I was like, wow, these guys are really good. And sure enough, you get, you know, the significant contagion effect in the data. Now, it's a really small effect. It's small print. That's like a 2-point font. And the coefficient is actually rather small, but it's there. There is evidence that physicians were influencing other physicians to adopt this new drug as it came out on the market. Okay, so that study was all fine and well, but the problem with this study and the classic diffusion data sets is they all measured the networks at one point in time, right? Typically at the beginning of the diffusion process. They measured the time of adoption either inconsistently or not completely, sometimes with prescription records, sometimes with recall, retrospective recall, and they only focused on exposure effects, and there was always missing data, right? You never get complete survey response rate. And I can levy these criticisms wholeheartedly because this is all my work, right? I'm the one that's done all this stuff wrong. And it turns out we can get other diffusion data, and in this case, I have data on exactly when countries ratified a new treaty that had been introduced in 2003. 2003, the World Health Organization created something called the Framework Convention for Tobacco Control. This is the law that specifies that you don't have any smoking in workplaces, they have to have warning labels on cigarettes, all kinds of different things that get specified in this treaty. The treaty was introduced in 2003, and then over the next decade, 85 to 90% of countries ratified the treaty, signed onto it. The US did not. The US never signs international treaties and is only one of 15 countries that refuse to ratify it. But still, I know exactly when countries ratified this treaty. And there's no missing data, right? There weren't any countries that dropped off the globe for a couple of years and then came back on. Everybody's there. And I can look at multiple networks. In fact, I can look at lots of different kinds of relationships that countries have with one another. So I have lots of network data. And I have data that's both dynamic and static. I mean, I have network data amongst these 190 countries over time that are changing all the time. In fact, for the first time in my life, I have exactly what I want. The other thing that we have is it turns out that from 1992 until 2012, there was an online tobacco control network that had been established that as of 2012 had 7,000 members. And these were people that were communicating to one another about all kinds of tobacco control activities. And I can aggregate now the data from all this global link communication to the country level and look at global link online communications between countries via this global link. So here's the FCTC diffusion curve. It takes off rather rapidly and then levels off. Here's another S-shaped curve. And then here's the hazard rate for the diffusion of the FCTC, which is the instantaneous probability that countries are going to ratify at any given year. Okay, so I've got innovation, I know when it was adopted, and I have all these different networks. In fact, I have, in this case at least, a whole bunch of different things that I can look at to understand what influences countries' adoption of the FCTC. Is it country attributes, their population, their size, tobacco production, and so on? Or is it exposure to treaty ratifications by other countries that they trade with, or that they have other kinds of interactions with, and whether or not they're exposed to treaty ratifications by their global link communication partners. Make sense? Yep, good. So I had all of these different networks. I have geographic networks, which are static. Countries don't move around. I have trade networks, which are constantly changing each year. I have tobacco trade networks, which you would think would have an influence, and then global link networks. In fact, I have 3 different global link networks. In order to be a member of Global Link, you had to have a global link, 2 global link people verify that you are indeed a tobacco control advocate and not a member of a tobacco company. So I have referrals. Yeah, it's very sensitive stuff. And then global link posts. There's all kinds of posts that go on here. If I post a message, did you reply to it, and so on and so forth. And then subscriptions. So there are 43 different subscription services you could have on Global Link, and if countries were subscribing to the same thing, they would be connected via those co-subscriptions. I have a statistical model. It's the same one I've been running before, this event history analysis model. And then I do my analysis. And here again, we have time, right? And so the time effects are very significant early. And you saw that in the curve, right? In the beginning, it takes off, and then it levels off. So in the beginning, there's a strong influence of time, and then it disappears. Now we can look at exposure effects, and I get, let me see if I can lift this up. Oh, no, it doesn't work. I get a strong and significant exposure term. So countries that are exposed to ratifications by other countries that they have subscription co-membership with are more likely to ratify the FCTC. Right? So if we're connected via this Global Link subscription service, you adopt the FCTC, I'm more likely, in fact, much more likely, to ratify the FCTC in the next year. But I wanted to take it a step further. I don't want to just look at exposure terms. I want to build time into our analysis, which is something that we never, ever do. And in fact, I developed this theoretical model that incorporates all the different effects I've been talking about into one model. And in this model, I have external influences, which is this red line coming down here. And this model says that external influences on adoption behavior is going to be very high at the beginning. Why is that? There's nobody else in the system that's adopted it. So the only way I can be influenced is by something external to it, right? Has to be from the outside. But as the system fills with adopters, my preference is to get information from colleagues and peers and friends, not from external sources. They become irrelevant over time. The next curve is for selection influences. And what is selection? Selection is making a change in your network to somebody who does the behavior you're about to do. At the beginning of time, there's nobody in the network that does the behavior. So if I want to do it, I have to purposefully go and find somebody who shares that behavior with me, right? When I'm a smoker in 6th grade, there's no other smokers in 6th grade. So if I smoke, I have to go find somebody to smoke with. Right? It's going to change my network. It's not going to exist there. But again, over time, as the behavior becomes normative, that tendency goes down because I now no longer have to make changes in my network to find people that do what I want to do. Conversely, of course, social influence is going to go up over time. As the behavior becomes normative and my peers start to do it, I'm more likely to do it. Right? My resistance goes down, my influence goes up. And then finally, and sort of most interestingly, is what is the role of opinion leaders or popular people in the system? And this will change. Those other three are constant across all different kinds of behaviors. But what happens with the prominent people will change depending on the cultural compatibility of the behavior, what's normative, whether or not it's something that is easily adopted by the community, whether or not opinion leaders think it's going to be accepted by the community, and so on. So this little curve right here, this little curve, all the way up, this little curve is going to move around. Where it peaks, I think, changes depending on the behavior and the setting and so on. So then I do a statistical analysis for external influence, internal influences, and opinion leaders, and I find some support for the model. In fact, bless you, I find that external influence does decrease over time. It's not quite statistically significant, but there's a trend there. And I also don't have the greatest measure for external influence, because it's hard to measure things external to the world trading system. Internal influence, the coefficient is negative, and that's what you would expect, because over time it takes less people to influence you over time. And then opinion leaders, if I put in a dummy term for years 2005, 2006, during the early stage of diffusion, but not the earliest, you get a significant effect, not quite 0.05, but close enough, showing that there is an effect of these opinion leaders early in the process, and then it decays. Because after it starts to spread more widely, after you get to 50% adoption, opinion leaders lose their power of influence, right? Because it's already become normative. The other thing, and I don't have time to go into this, but we can take this micro-level analysis and we can create terms for infectiousness and susceptibility, right? Susceptibility is the extent to which, let's do infection first. Infection is the extent to which that people are connected to you adopt in the time period immediately after you've adopted, right? So Claire nominates me as somebody she goes to advice. I started prescribing a new drug. in the exact next month or next year, she starts to prescribe it. So I've infected her. Anybody that's connected to me that waits 2 or 3 years, I didn't infect, right? Because they didn't adopt immediately after I did. So we can create terms for susceptibility and infectiousness and look at what are the individual attributes and network factors that are associated with being susceptible or being infectious within a system. And again, this is where having this micro time level analysis gives us a perch on doing analysis that we couldn't do otherwise. So, over the years, right, I've been doing network studies and network influence studies, and people would always ask, well, if networks are so important, how can we use them to create change programs, right? What can we do with networks to make them work for us? And so I've been developing this field of network interventions where we collect network data and use it purposefully to design intervention programs. And I was lucky enough to sort of write all this stuff up and get it accepted in Science, and some of you may have seen this paper, which goes into a little more detail about all this than I'll be able to do today. So I want to present the ways that we've used network data for network interventions, but before I do that, there are 3 principles that I always like to underscore that are true for all kinds of behavior change interventions, but I think are particularly true for network ones. And the first is that your program goals matter. Now, all of you that have been through a basic evaluation class know that specifying your goals and objectives is really important. But it's definitely true for network interventions because what you're trying to do is going to determine in part the kind of intervention you want to create, right? Sometimes you want to fragment networks. Sometimes you want to make them more cohesive. And I always use the example of STDs. You can reduce the rates of STDs through 2 mechanisms. 1, fragment the sexual contact network, or 2, accelerate the spread of condom use or other protective measures, right? So, but they're 2 very different things, and they have very different implications for network interventions. The second is that theory matters. And you know, at the beginning of my public health career, I was trained as a mathematician, right? Do I think we know anything about theory? No. You know, theory's dumb. Just give me the numbers. But it turns out, I think that we have developed very strong understanding of what motivates people's behaviors. We have very good behavior change theory. And although we oftentimes need to do qualitative work and it takes a lot of experience working with communities, we can articulate good theories about why people do the things that they do and what prevents them from doing the things that we want them to do. And if we can specify that behavior change mechanism, it will help us get a perch on the kind of intervention to choose. And I'll actually later on in a few minutes have something more specific to say about that. And then finally, and I think this is the most important principle, and that is that as an interventionist using network methods, we should intend to use them to learn from the community as well as try to induce change on it, right? My initial conception was we map the network, we take the lever, we pull the lever, everything goes, fame and fortune comes to me, we're done. But that's not the way it works, right? Actually, our job is to work with communities to give them the tools that they need to bring about change. I think mapping networks and providing network metrics is one way of doing that, but it's really up to the community to drive change, not us typically as outsiders. Certainly not me as an outsider. Okay, so the big contribution of this paper is this table. I don't have time to go into the details on this table, but suffice it to say it breaks down network interventions into three different levels: strategy, tactic, and operationalization. Now, for those of you that aren't marketing gurus, I'll explain to you what strategy, tactic, and operation means. And the best way to explain it is through the one network intervention that you're most familiar with, which is identifying opinion leaders to bring about change, right? Oftentimes, when you want to change an organization or a community, we are looking to identify individuals that are going to be our change agents, or that are going to be the ones that are responsible for bringing about the change. Now, most of the time when we do that, we're trying to find leaders, right? We want community leaders, or organizational leaders, or popular opinion leaders, knowledge leaders, called by a lot of different things. So we're identifying individuals, and the tactic that we're trying to do is, of course, identify leaders. But there are many settings in which we would want to identify other kinds of individuals. But the first tactic, and the one most frequently used, of course, is identifying leaders. Now, from a network perspective, we have dozens of different ways that we can measure what it means to be central in a network. Right? A person is central if they receive a lot of nominations. That's in-degree centrality. A person is central if they can reach everybody via fewer steps than everybody else. That's closeness centrality. A person is central if they lie on the paths connecting other people in the network. That's betweenness centrality. A person is central if their eigenvector score is higher than anybody else's. Eigenvector centrality. A person is central if they're connected to people who have high centrality, right? That's power centrality. So in the network world, we've devised a lot of different mathematical and computational algorithms for calculating what it means to be central in a network. Now, of the 24 or so network interventions that have identified peer opinion leaders and shown them to be effective agents of change, we have always used in-degree centrality. Flat out, that's what we've done, even though we have all these other choices, right? Now, you can imagine there are different settings where you might want to identify bridging individuals or key players in the network and so on. The next strategy is segmentation. And in segmentation, you take a network map and you break it up into subgroups. So you break it up into subpositions. And of course, we have induction techniques, word-of-mouth marketing, snowball, matching leaders to learners, and so on and so forth. And then finally, yes?
Could you explain what is meant by random excitation?
So word of mouth, so typically in word of mouth, you're launching some kind of media program. Or for example, now if you buy tickets to a sporting event or a concert, it'll automatically post it to your Facebook page, right? So that is, you as the interventionist have no control over who's exciting and spreading it out on the network, but that's what it is. So it's sort of randomly generated excitation of the communications along your network pathways. There's non-random excitation, which happens in dormitories and fraternities, but that's another different. And the final strategy, which I initially called manipulation, which turned out to be not a very good term when we were talking about this, so I switched it to alteration. But it's basically making changes to the network. And these are sort of the hardest to do. Deleting or adding nodes, deleting or adding links, and rewiring the networks on some kind of behaviors. Now, I don't have time to go into the details on all of these, and I'll just briefly mention, we've done a lot of work with opinion leaders. We run simulations and show how much better it is to start innovation diffusion with opinion leaders. There's been, we did a sort of meta-analysis of all these different kinds of opinion leader interventions. There was a Cochrane review that just came out in 2011 documenting the power of opinion leader interventions and so on. And then here's a map sort of for all those different things. And I'll just mention briefly this little diagram, which is really important to emphasize, and that is that there are different kinds of opinion leaders, right? When we do large national marketing campaigns, we can identify national opinion leaders, but they are good at making changes at the early stages of diffusion of innovations, at raising awareness and legitimizing a new product, but they don't help people move towards the latter stages of the adoption process, right? It takes, well, I argue it takes regional and local opinion leaders to drive change. If I'm going to adopt something new, I need somebody in my network I can go to for advice and help to get that advice and help from, right? And so leadership occurs at lots of different levels, national, regional, and local, depending on what you're doing. Okay, and then I created a hypothetical network to sort of illustrate and diagram all of these different network intervention techniques. And so I'll just show you some pictures from this hypothetical network. Right, this here illustrates those that have high in-degree, the nodes that have the highest closeness, the highest betweenness, who the key player positive individuals are, the key player negative, brokers, bridges, low threshold adopters, segmentation, what are the groups in the network, what are the positions in the network, what's the network from a hierarchy look like, and so on. And I'll mention to me, sort of what the most significant kind of network intervention that I've worked on, which is this notion that leadership is proximal and influence is proximal. And by that I mean, you take this network, and if you're looking at person number 22, if you want to change the behavior of 22, right, finding somebody who's an opinion leader over here is not going to be helpful. 3 is very far away from 22. In fact, if 3 does something, 22 is just as likely to take that as a signal that it's not what they're supposed to do, right? You have the sharks over here and the jets over here. Once they do something on this side, it's not going to be embraced on the other side. If you want to change the behavior of 22, you need to find a leader that's connected to 22, which in this case would be 18. So we developed this optimal leader-learner matching algorithm where once leaders are identified, they are matched to the people who nominate them specifically, right? Because that's who's going to influence them. And we've tested that out in a randomized controlled trial. Here are some of the other ones and so on. And then this slide is here just to emphasize, obviously this is not a complete listing of all the possible network interventions, and people are still working with these network techniques to develop new and different kinds of network interventions. So this field, I think right now, is kind of somewhat rapidly evolving and developing. This is the RStudio interface. All the stuff I've done on network interventions, all the stuff I've shown you on diffusion network influences has all been coded up in R. And we are probably a couple months away from sort of releasing it all into a new library that will be publicly available. And I'm willing to share it with anybody, because obviously if you want to do this stuff and you use my stuff, it's going to be great for me. All right? So feel free to contact me if you want any of these R programs. In 2 or 3 months, they'll be a lot better than they are right now, but we're getting there. Okay, so just a brief mention about selecting a network intervention, right? Because you obviously ask, well, if we have all these network interventions, and I think one of the surprising findings about this review is that there really are a lot of choices, most of which have never been tried at all, which makes sense, but have not been used and certainly not documented. But if you are going to select a network intervention, there are some factors to consider, like what's the existing prevalence, is there an existing network, what kind of behavior are we talking about, and so on. But one of the things that occurred to me that I think is interesting and I'd like to see developed is this notion that if we know what kind of theoretical mechanisms are driving the behaviors in our community, they make suggestions for the kinds of network interventions that you would choose. And I think this is a kind of provocative but also a very interesting notion. You know, this is all speculation, right? Obviously, this hasn't been done. But when you think about what is the overarching behavioral change mechanism that's sort of driving the community, it does make suggestions about the kind of network intervention you should choose, which I think is a pretty cool idea. Okay, and then the last little mini topic I wanted to address is, I've talked about networks very generally, but I haven't discussed what do I mean by networks. And in fact, we measure lots of different kinds of networks, right? Friendship, advice-seeking, discussion, and so on. And typically, when we're doing interventions, the 2 kinds of networks that we measure the most frequently are advice networks and discussion networks. And that's because 2 of the biggest drivers and barriers to behavior change are expertise and trust, right? And so different kinds of interventions may require different kinds of opinion leaders to discover. So if the barrier to behavior change is technical, right, I don't know how to do it, then you look for expertise networks. But if the barrier to change is cultural, I don't know what to do, I don't know what I should do, then the network of influence is going to be one of trust, which we typically measure through discussion. So these advice networks are very hierarchical, right? There are a few people in the organization that have the knowledge and know-how, and that's who everybody goes to. Discussion networks tend to be more horizontal, right? You discuss things with lots of different colleagues. And when we do these kinds of interventions, we actually find that there are people that are high on expertise but low in trust, or high on trust and low in expertise, and then, you know, the sort of Goldilocks leaders that have both. Right? They know how to do things, and they are the kind of people that you want to go to and have them help you. Right? We all know people that are really, really expert, but we don't want to go and ask them questions because they talk over our head, or they're not very nice about it, or, you know, they're hard to get a hold of, or whatever. And we know people here that we trust a lot, that we think have our best interests, but they aren't necessarily super knowledgeable about, you know, the latest and greatest thing. But there are these people here that have both of those qualities. They're really knowledgeable, and they're really, really approachable. And so when we're doing these kinds of interventions, I often recommend that we measure both expertise and trust. Now, a lot of studies also try to include social and formal relations. I think that's important, but I also find that that sometimes raises, if people don't want to tell you who they socialize with outside of the organization or outside of work and so on, and I get that and I understand that. Okay, and then just real quickly, some data from these two kinds of networks. And I showed you this before. The discussion links are in blue. The expertise ones are in gold. You can see that sometimes they overlap and sometimes they don't. Now, when we ask from the same community who are the most important or prominent individuals in this community, you get a very different network, right? It becomes much more centralized. There are new people that pop up as being the ones that receive all of the nominations. And when we do an analysis of geographic distance, and I think even in this electronic age, geography still matters a lot, what we find, of course, is that for primary care physicians relative to specialists, the distances are a lot smaller, right? So PCPs have discussion partners that are in their local community much more than specialists, which is what you would expect. And when you look at the difference in distance between discussion and advice partners, that difference is also different. You're more likely to discuss issues with people that are near you, less likely, or the people that you go to for advice are more likely to be further away. So there's a lot of construct validity there to the way these networks are measured. Okay, so we've got very powerful network theories and methods that I think are helpful for behavioral interventions, as well as understanding how how communities and individuals act. And our tools for doing network analysis are getting better than ever. I mean, I know a lot of people think this is a complicated area, but really the tools have become really quite accessible and easy to use. And there is this issue now of massive passive data, right? The big data stuff that's coming online. And a lot of it has value precisely because it's network data. It measures who's connected to whom and how they're connected. This social network analysis has really become something that's kind of trendy. There are now, you know, journals, network biology, network molecular epidemiology, all these different kinds of network things that are coming up and being very important. And I think that's good. That's a sign that we're moving into a new era where we understand that connections and structure are really, really important. NIH is starting to fund some network analysis. I mean, when I started in this field 25 years ago, there was no funding for social network analysis. Now there is some funding that's available. And I think that doing network experiments is going to be a place where we really see a lot of action in this area, where we're comparing different kinds of network interventions and trying to sort out the sort of success of network interventions. And honestly, what's going to happen next is really combining SNA with existing health promotion programs that are quite well developed, actually, but that ignore the network structure, or at least don't attempt to measure it in a sort of concrete, solid way. There's, I think, now a sort of strong science base for the role of networks and their influences on behavior. This is a paradigm that's developing, and I almost think that the things that we do that ignore networks are going to become problematic. And these are a couple of the books that I've talked about. The network models of diffusion was my dissertation. And then the social networks and health book I wrote. I was actually planning to rewrite network models of diffusion of innovations, and I started to do it. I realized I had to explain networks, so I went into this whole rabbit hole of sort of explaining how social networks work and their influence on health. And since I teach a class on social networks, this ended up sort of growing out of that. So still to be done is a new version of network models of diffusion of innovations. So thank you for your attention. Thank you for inviting me. And we have a little bit of time for Q&A, right? So, good. Yes, ma'am.
This is very interesting. Thank you. So for economists that deal with observational data in studies, they were always struggling to with the selection issue, right? Because program policy or policies that will be applied will not have any effect if it's purely selection. So people say with mental health issues, selecting into a neighborhood because that's the rent they can afford might then have similar behaviors that have nothing to do with their connection to each other, but just because they have selected not directly through one behavior, but through other correlated things. And so it seems to me that your approach is to account for selection by modeling the other more obvious things like the influence or the leadership components of the network effect. And that way, the selection would be what is left. Right. And
so there's a couple of responses. I mean, one, oftentimes when I enter into a system, I can acknowledge that there's a lot of things that have happened before that give rise to the network the way it is. But if I want to do an intervention with that community, I don't have to worry about why they're here now and why they're connected. All I need to know is that they are connected and that these are the key important points, right? Firstly. Secondly, when I'm measuring friendships, say, in a school, and if I do that over time, I can explicitly model the selection of new friends and find out what are the predictors of those friendship selections. And I can incorporate individual attributes. Maybe it's based on, the likelihood increases because they're the same ethnicity. But I can also look, well, they're in the same classroom, or they have the same academic grades, and these lead to a greater propensity of being connected. But then I can also look and see, well, were they connected to the same third person at the time period before? Now I know, oh, that connection, net of all these other selection attributes, is a product of being connected to somebody else. And that kind of evolutionary mechanism that we can build into this network statistical models is really, really powerful. So I don't think it solves all the selection effects, but it certainly addresses them at either an immediate micro scale or in some sense ignores them at a macro one. Yes, Darcy.
And when you ask your question, if you would say your name and where you're coming from, that would be helpful to see who's here. Do you want to say? Sure. Francisca, I'm at the Mendel School of Applied Social Sciences.
Okay. Yes.
Hi. Thank you for your talk. I really enjoyed it. I'm from the anthropology department, and as a medical anthropologist, I was really curious about how you could factor in specifics of local culture into network models. And I was very happy to hear you talk about cultural compatibility. And I was curious to learn just a bit about the qualitative work that you mentioned in your communities.
Sure. Okay. So, I mean, this network analysis grew up from anthropology, actually. It was a method that anthropologists spend a lot of time living in communities doing ethnography. And once they did that, you have to find ways to sort of display and describe these communities. And it turns out their networks are very important. Kinship structures, networks of economic and labor exchange, and so on. And so it became a very powerful method through that. And I think it's a methodology that's been strongly embraced by medical anthropologists. But I think the big question, of course, is, well, how do you incorporate culture into this? And in a way, it depends on what you mean by that. So certainly, when you go into a community, any community, there are cultural norms that exist there in organizations and so on. And in part, the network structures are going to be culturally defined, right? We select people that we want to spend time with because we share cultural attributes. Part of that homophily is cultural, you know. I really like hanging out with other Italians because we can go eat Italian food, that sort of thing. So culture's there. But do we make it a definable different variable? No, I think because most of the time with network analysis we're trying to get a deep understanding of the community, and usually that community has cultural boundaries around it. And when we go into a community and there are different subcultures within that community, that will be apparent by the network mapping. So I've seen a number of studies where students of mine have gone and mapped their own school at the university, and it turns out there'll be two different departments or divisions in the school. In communication, it's oftentimes mass media versus interpersonal communication. And when you look at their co-authorships, their reports of friendships, the committees that they sit on, they're completely bifurcated, right? Because they're two different cultures. So the different cultures that they have become apparent from the network data, who nominated whom. Do I do a lot of qualitative ethnographic work in communities? No, that's not necessarily a good use of my time. I'm not very good at it. I'll be the first to admit I'm not a very observant person, and I think to be a good ethnographer and to be a good qualitative researcher, you have to pay attention to what's going on around you, and I don't do a very good job of that. And I'd much rather have people who do that well do it rather than I'm mostly a numbers guy, you know, so that sort of thing. And that's why I'm very comfortable saying these are tools for you to use. I'm not going to try to use these tools on you. I'm going to do whatever I can to give you tools to help you do what you try to do. In short. Yes?
Can you introduce yourself?
I'm Diane Sun. I'm a professor in class statistics. First question is about your R library. So S&A, is this out or not out?
So there's an R library for doing social network analysis that's already out, that's been out for 5 or 6 years. Okay? You can, if you load StatNet, you get all the SNA libraries. And it calculates lots of network metrics for you and so on. And then with that come network statistical programs, the exponential random graph model programs that are available for doing network statistical models and so on. The libraries that I'm referring to are the one for network interventions and the other one for diffusion network modeling, which will be separate.
How does that compare with SNORT?
With what?
SNORT.
I don't know.
That's another R library for social network.
SNORT?
Yes.
I don't know that one.
Okay. So another philosophical question.
Okay.
So I was pretty intrigued by various things you were talking about. So I was thinking about a few things. You talk about centrality. So someone who is popular, everything goes to that person. Has anyone done the study, centrality versus happiness? The person who is central is happier? Everybody is following him? Or?
Well, so that's a good philosophical question, and I can give you a rather long answer to it. So first thing that we know is the converse of that is true, that people who are marginal in communities are generally unhappy. And we know from a lot of adolescent data that students who are on the marginals and isolated from friendship networks in schools are at greater risk for mental illness, suicide ideation, suicide attempts, and suicide attempts with injury, right? So that's a big concern. And we are creating interventions very specifically to address that problem. Secondly, being the most popular is not unambiguously a good thing. And we know that from research. So it turns out you don't want to be the most popular. Why? That's a lot of pressure, right? There's a high expectation, A, that you're going to remain popular, B, that you're going to do things that everybody embraces, and C, you are constrained from doing anything that is against the norms and the culture of that community. Because if you do anything to change that's in contra-opposition to what's normative in the community, you will lose that position of popularity. And it turns out that as human beings, we have an innate preference not to, ever decline in our rate of popularity. So it's actually a really, really big problem. And so leadership and being popular and occupying these central positions is not an unambiguous good. And so one step further, we know from diffusion studies that leaders are generally not the earliest adopters of innovations. They can't be. They have to wait and assess whether or not the community is going to embrace the product or idea before they're able to adopt it. So they can't be the earliest adopters. And typically, when you're very popular within a community, that constrains your ability to have contacts outside of that community where you can precisely come into contact with other new ideas, products, and services, right? And so it turns out that the people that actually bridge different communities are oftentimes the most innovative and the most amenable to change. That's the short answer. Yeah. Yes?
My name is Kamil Topal. I am a PhD student at Electrical Engineering and Computer Science Department.
Okay.
And I would like to ask homophily property. When you give us an example for homophily, the relationships are in the same place, like for example in school or something.
Right, right.
How about online social network analysis?
That's a good question, and obviously there's a lot of people now interested in the way online relationships are developing and the extent to which they're homophilous. Now, I would say that you would think that going online gives you the opportunity to break out of your homophilous enclaves, right? But most of us end up joining communities that are like-minded. And so many of the very popular social networking sites are ones that are created around a behavior that may create a lot of homophily. So for example, sexual orientation websites or people with certain kinds of disease conditions and so on. You know, my Facebook friends, it's a pretty homophilous group, right? Because they grow out of who I come into contact with in the real world. So I don't know that a study has been done specifically to make those comparisons, but my intuition is that online worlds are probably about as homophilous as face-to-face ones.
But sometimes people may follow their followees who may not be their favorite.
That's certainly true, but then again, is a Twitter following relationship the same as a close friend that you go to lunch with twice a week? I don't think so, right? So you may have less homophily for very weak relationships, yes. And I think it's probably true in the real world as well. Yes. Patricia.
School of Nursing. So this is a basic methodological question that I struggle with. Maybe it's answered in your second book here, but either prospectively or retrospectively, it seems to me making your boundaries of your network, who to include and who to exclude, is a qualitative and a tough thing. So if you could just spend a couple minutes.
Yes, no, it absolutely is. And the boundary specification problem has long been a big challenge in network analysis. In some places, it's easy to do. You're in a school, you're in a school. Yes, it doesn't capture everybody, but it does capture most of the important and relevant relationships for children of that age. Now, that's less true if you're in an alternative high school where kids may sort of come in and out of the school. And we have egocentric techniques that enable us to measure friendships that are anywhere. It doesn't give us the same power as these sociometric techniques where we interview everyone in a bounded community, but it does give us a perch on the influence of relationships outside of that boundary. And we've actually done a paper comparing the changing in boundary conditions to sort of show that that's true. That was a big criticism of network analysis up until the turn of the century, that it was all based on small samples, closed bounded communities. Now, of course, with the power of big data, we are getting increasing network studies where the boundary is a lot less specified and it's getting larger and larger and larger. And the results coming back from those studies do not contradict the ones that we had in the smaller communities. So that's reassuring. Now, but it doesn't answer your question, can you draw a boundary? Sometimes you can, sometimes you can't. And from a network analyst perspective, it's great when you can and it's simple. When you can't, you have to oftentimes turn to other techniques. And many of you are probably familiar with the respondent-driven sampling techniques that have been done, or the snowball sampling, or the cascade sampling, that enables you to not specify the boundary in advance. Now, the statistical models for those kinds of sampling strategies are still being worked out. They're somewhat imperfect, but you can still get network data if you want to. I would argue, though, many of us spend our time within bounded situations, the organizations where we work, our family systems, and so on and so forth. Yes, ma'am.
Meredith Francis from the Mandel School as well. Going back to the online issue, one of the things you've mentioned was that the effects tend to be weaker for those relationships. But I'm wondering if anybody has looked at people whose networks have very primary relationships online.
Oh, so that's a good point. Yes, I was talking online relationships very generally. But I think your point is, for people who have very strong connections with an online community, those effects can be very strong. So, for example, pregnancy websites, right? People go to self-support groups and when they become pregnant, and they can get very involved in those websites, get a lot of information from them, exchange information with other people and so on. And so I think and I think it's in these specialty environments where there is a lot of homophily that you get pretty strong online effects. I would still argue, though, and I don't know if we'll ever have definitive evidence on this, that the face-to-face influences are still always going to be stronger. Now, I'm a communication person, but it seems to me that any time communications are mediated, their effect to change our behavior is attenuated. And what we rarely do, and which I make a lot of proclamations about, is we rarely measure with whom the communications are consumed. So if you and I are, we're on a pregnancy website, we just got pregnant, we're exchanging information about, whether or not we're going to breastfeed or use formula or whatnot. But Clara's over visiting me when I'm doing this. I'm going to interpret and understand the communications that we have differently when she's there than when not, right? And so there's that other level of network effect that occurs in which the communications are influenced by the social environment within which you receive it or exchange it, which I think is a very important point that we always ignore.
So I've heard this diffusion model rule that if you get 15% of the population to adopt,
hogwash. Hogwash, right? So that's the idea. You reach critical mass, right? And so the problem with that, of course, is, well, if you got to 15% and it was okay, then by definition, the 1% that you got to was sufficient to get you to the 15%, right? So there's no reason that that 15% is a magical number. The only reason people like it, and the only reason I liked it many years ago, was because mathematically it looks really neat, right? That's where the second derivative is 0. But there's no evidence to suggest that that's a magic number. And in fact, when you look at it from a network perspective, if that first 15% is all on the margins of the network, then you're still going to have slow uptake. So it matters who those 15% are. It matters the network position of those early adopters. So the best thing that you can say is a good critical mass point is when you have a ratio of adopters to non-adopters in good asymmetric relationships that would lead you to believe that you're going to get faster uptake. And that's in the network models of diffusion of innovations, I make that point very strongly, that it really matters who the first adopters are, not how many there are. Yes, sir?
I'm Justin Lee, and I'm a second year graduate student in the Department of Electrical Engineering.
And you're sitting right next to somebody else who's EE Computer Science. Okay. Did you? But you talk online too, so yeah.
So I'm a master's student. Actually, I'm also looking for a PhD position in Enterprise. So my question for you is, how do you build a network for patients? Like you said, you have a network of all the customers of the company, which you build by sending the customers emails. You send them the surveys so that it can build the network. But in the real world, like I have been working for healthcare companies and hospitals, and I often I came across a database of tens of thousands of patients, and I was trying to build a network, a social network. But I mean, unlike Facebook, Twitter, if it's a friendship, there's a connection, so there's a network. But for the patients,
but there isn't a network there, right? Just because you have a list of patients, you don't know how those patients are connected to one another.
I haven't come up with a good idea.
Yeah.
How, I think it's things you are working in throughout medicine, and I think you have built some networks for patients.
Yeah, but you would only know that they're a network if you can somehow survey them and ask which ones know which other ones, which would be very unlikely to do.
But if it's like tens of thousands of patients,
yeah.
It would be invisible.
It wouldn't be impossible. It would be easy. Just have a large database. But there's no reason for them to participate in that kind of exercise, so you wouldn't get a very good response rate. Yes, sir.
Jeff Basine, Cleveland Clinic. So following up on that question, Obama's Precision Medicine Initiative is proposing a portion of that to be studying health behaviors and tying that with complex diseases, and they're proposing to recruit 1 million or more patients and put a lot of money into a lot of research on a very, very large cohort, part of the whole big data initiative. And so they're currently basically asking the public and the research community what types of study designs should be a component of that if we're going to spend all this money. So I was wondering if you had any ideas, talking about how we don't have social networks for patients. Might there be a role with the NIH's Big Data Initiative or the Precision Medicine Initiative to actually design a study that could look at how social networks might actually directly play into patient behavior choices that then end up causing or creating risk for complex disease?
That'd be a great idea. I mean, I could think of a couple of things that you might consider. One, of course, is to start with some experimental sites that are relatively bounded, rural communities or even neighborhoods, that you could say, well, let's look comprehensively at the whole network here in this community and find out what kinds of quote-unquote social capital or resources are available and whatnot. The other, of course, is to routinely incorporate assessments of social networks and social support scales in the measurement of these populations, because I would imagine that you'd find a fairly strong signal that social networks and social support are an important component of people's health. So I would think those would be the two kind of ways that you could go. The other would be to think about community-based network interventions. And there are some of these things that are happening, the Blue Zones project and whatnot, where they're working within healthcare systems and saying, okay, we've got all these patients, some of them are linked up, some of them are not. Let's start creating programs that are community-based, that are network-oriented, that bring people together, create running groups, yoga groups, and so on. And let's face it, a lot of the interventions do work precisely because groups of people get excited about it and continue to go back and friendships build. And, you know, there are people that go to their book club because their friends go to the book club. They've made friends through that association and it's built up. So that kind of thinking would be very helpful to imbue into this initiative. But it would depend on how much money you could get to do different things. Yeah, always, always, always. Okay, well, we've used up our time here this afternoon. Thank you all for coming. I really appreciate your suggestions and your advice. Yep.